Good day everyone and welcome to this platform with Dr. Moje, where we talk about everything concerning our health. And today we're going to briefly touch on hypertension. I'm sure many of us already know what hypertension is because it's a major problem that plagues us today. Hypertension is also known as the silent killer because many people have it and may not even know they have it until it presents with symptoms, usually in the advanced stage warranting the use of medication or antihypertensives as we may have it. So a simple definition of hypertension is a condition in which the force of the blood against the blood vessels is increased. A good example would be passing water through a thin hose, passing high pressured water through a thin hose. Now, when this water is passing through the thin hose, it actually generates very high pressure. So this is some kind of example that we can use to give ourselves a clear picture of what hypertension is. When the blood vessel is tiny, the pressure of blood going through the vessel tends to increase, and this can be due to a whole lot of reasons. It can be due to old age, it can be due to medication, it can be due to even genetics at the same time. So there are so many reasons that lead to hypertension. Stress is a contributory factor to hypertension, but it's not necessarily a primary cause of hypertension. Chronic exposure to stress may contribute to hypertension, but it is not a major cause per se to hypertension. Like, for me, I would not just go and tell someone that, oh, it's because of the stress you have hypertension. We go through stress every day, and blood pressure is not the same during the course of the day because of the hormone cortisol that's being produced in our bodies that helps us to adapt to stressful situations. There would be times when the blood pressure would increase, but this is not a major reason for increased blood pressure. But chronic exposure to stress is a contributory factor to blood pressure. Now, there are general classifications of blood pressure. If we want to classify them, we'll classify them according to the cause, which is primary and secondary hypertension. Primary hypertension, also known as essential hypertension, is this kind of hypertension that's not related to any cause per se. It's heavily genetic. So this is due to genetics, meaning DNA, meaning if the mother or grandfather or grandmother had it, it can be passed from generation to generation to the offspring. So in other words, primary hypertension is not necessarily due to a specific cause, it's most likely genetic. On the other hand, secondary hypertension is due to a particular cause, most likely due to kidney involvement. If there is affection of kidney, for example, glomerulonephritis, renal artery stenosis, endocrine issues, most likely Cushing's disease, Cone syndrome, pheochromocytoma, acromegaly, corticosteroid use, or oral contraceptive pills. Yes, oral contraceptive pills contributes to high blood pressure. Then neurogenic, let's assume issues with trauma to the skull, trauma to the brain, what we call raised intracranial pressure due to bleeding in the vault of the brain. And then we have aortic coarctation. Then we have stress, which I had said is a contributing factor. And then there are some sources that also say people who are of a smaller stature are also at risk of having hypertension. Yes, and then we also have pregnancy-induced hypertension. So, of course, when we are having issues with the kidney, there is a mechanism that actually induces this hypertension in order for the kidney to save itself, and it's called the activation of the renin-angiotensin-aldosterone pathway. So this is a way of the kidney to actually increase blood pressure so that it can get more of that blood to perform function. But then the more it does this, the more it actually creates more complications for itself, because chronic high blood pressure would actually lead to chronic kidney damage on the long run. So of course, I didn't mean to say all this whatever I had said, but well, these are some of the issues. We have endocrine issues, renal issues, we have issues with chronic exposure to stress, we have neurogenic issues, and then we even have the vascular issues. So these are some of the things that actually would cause secondary hypertension. So we're going to be looking at various readings which would show us what the normal blood pressure should be, as well as what pre-hypertension, stage 1 hypertension, and stage 2 hypertension are. So according to the Joint National Committee or JNC classification of hypertension, normal blood pressure should be within a systolic value of less than 120 millimeters of mercury, that's the top number, and then a diastolic value of less than 80 millimeters of mercury, which is the bottom number. And then when we are looking at pre-hypertension is a systolic value of 120 to 129 millimeters of mercury and a diastolic value of less than 80. This is a milder form of hypertension. Then we go to the next stage of pre-hypertension, which is a higher form of blood pressure, which is a value of 130 millimeters of mercury to 139 millimeters of mercury and a diastolic value of 80 to 89 millimeters of mercury. Now this may actually vary. So we have pre-hypertension stage 1, pre-hypertension stage 2. Any individual could fall within this range. So we could also look at it this way, as pre-hypertension being a systolic value of 120 millimeters of mercury to 139 millimeters of mercury and a diastolic value of greater than 80 to 89 millimeters of mercury. Now we look at stage 1 hypertension. Stage 1 hypertension is a systolic value of 140 millimeters of mercury to 159 millimeters of mercury, and a diastolic value of 90 to 99 millimeters of mercury. Now we look at stage 2 hypertension. Stage 2 hypertension is a systolic value greater than 160 millimeters of mercury to a diastolic value greater than 100 millimeters of mercury. Please keep in mind that there are various people who would react to their kind of hypertensive state. You know, some people may have higher blood pressure and may not have any form of symptoms, and some may have this same level of blood pressure and would come up with symptoms. And this is when we start talking about hypertensive urgency and hypertensive emergency. Now, when we are talking about hypertensive urgency, we are looking at a systolic value of greater than 180 with a diastolic value of greater than 110 to 120. Now, this would be without acute target organ damage. Now, this is what we define as hypertensive urgency. This is elevated blood pressure without organ affection. However, there are some sources which also say that a systolic value greater than 180 millimeters of mercury and a diastolic value of 100 millimeters of mercury without acute target organ damage is also known as hypertensive urgency. Now, comparing this with hypertensive emergency, we would have a systolic value of greater than 180 millimeters of mercury and a diastolic value of 120 millimeters of mercury with acute target organ damage. Could be affection of the brain, affection of the kidneys, affection of the eye, and what have you. There are some other sources which also say a systolic value greater than 200 millimeters of mercury and a diastolic value of 110 millimeters of mercury with acute target organ damage is also known as hypertensive emergency. Now, however the case may be, we can have a variation of blood pressures. There is no specific reading of blood pressure that would make one know that this is hypertensive emergency unless we have acute target organ damage. So it could happen with a blood pressure greater than 170 or greater than 180 or greater than 160, but we would have acute target organ damage with this particular blood pressure reading, which would give your clinician the clue towards the stage or the state of the hypertension. Now, we are going to look at some of the symptoms of hypertension. Now, it could be a myriad of symptoms, from blurry vision to headache. There could be vomiting. You have chest pain, palpitations, this feeling that the heart is beating, like you can feel the heart beat. There is dizziness, blurry vision, shortness of breath, blood in urine, and decreased erection, because we all know that erection is as a result of blood flow to the spongy tissue of the male organ, or we say the penis. Now, in hypertension, erection is affected because we are not having proper luminal dilatation of the vessels in the penis. And of course, the vessels are the major factor that leads to proper erection in males. So it's very important to check your blood pressure regularly, most especially with in those with strong family history of high blood pressure, because it could lead to chronic kidney damage, it could lead to affection of the heart, stroke, hemorrhagic stroke, ischemic stroke, what have you. So why are we talking about acute target organ damage? Well, this is as a result of long-standing untreated high blood pressure. You see, you have some patients who have been prescribed drugs as a result of diagnosis of being hypertensive, and then told to go get these drugs, go home and return in a couple of weeks or months, so that the progression of the disease would be monitored. But then they go home, start the medication. Once they feel better or they realize that they've been getting occasional normal readings of blood pressure, they cease to come to their doctor for review and only would come when they start having symptoms again. This is a very harmful practice, because you are supposed to take your blood pressure medications as directed by your doctor every single day. In fact, every single day of your life until your next review demands you to do otherwise. Now, this could be as a result of probably maybe blood pressure has been normal for a very long time and is within optimal range. You may be told to reduce the dosage of your medications, probably from every day to to alternate days, or probably every 2 days, depending on how you respond. And for some people, just one medication may not even be enough to control blood pressure. You might need to add more medications. You might need to add 1, 2, 3, or 4, depending on how the body responds to this antihypertensive medication. For example, we have the treatment with angiotensin converting enzyme inhibitors like Elanapril or captopril, which is being used for the treatment of hypertensive urgency. We also have calcium channel blockers like amlodipine, like nifedipine, and the rest of them, which are also being used for this particular treatment of hypertensive urgency. And then we have hypertensive emergency, which warrants admission to the ICU, the intensive care unit, and will be treated with blood pressure medications like nitrates, labetalol, hydralazine, and the rest of these medications. So it's very important you check your blood pressure, most especially for those who have been diagnosed. You should check it at least when you go home. You should check it at least 2 times daily for a period of weeks to months, and then you should always make sure you are regular on your blood pressure checks as well as your clinic checks. And for those with uncontrolled blood pressure, please go to the hospital for treatment, because uncontrolled blood pressure can lead to affection of the heart, affection of the brain, and kidney damage. It's very important to know these facts. Thank you very much, and see you in the next video.